Hi, everyone, and welcome. For today's class, we will be talking about psychotic disorders, but more specifically schizophrenia. I will have a PowerPoint presented for you, as well as a few assessments and resources later on at the end. If there are any questions, please feel free to ask, and I will do my best to answer them after the presentation. All right, so let's get started. Okay. I will also be providing a video to show, and it'll go a little bit more into depth with what I'll be covering today. Alrighty. Let's get started. So like I said, we're going to be talking about schizophrenia, and it is a psychotic disorder. So in the DSM-5, all the psychotic disorders are in the same group, but there are several types of schizophrenia, and they could be paranoid, disorganized, catatonic, undifferentiated, or residual. But the other psychotic disorders are schizotypal personality disorder, brief psychotic disorder, schizophreniform disorder, schizoaffective disorder, substance medication-induced psychotic disorder, and psychotic disorder due to another medical condition. And they all have similar abnormalities of the 5 following domains, which are delusions, hallucinations, disorganized thinking, speech, grossly disorganized or abnormal motor behavior, including catatonia, negative symptoms, but there's also positive symptoms as well. So a little history of schizophrenia. It was discovered in 1887 by Dr. Emil Kraepelin, but before we called it schizophrenia, Kraepelin called it dementia praecox and confused it as a part of dementia. And Eugene Bleuler ended up coming up with the term schizophrenia in 1911. And many people confuse schizophrenia as some type of personality disorder because they assume that it's a split in the personality and like behavior, but it is a split within the fragment thinking in the mind. So it's more of like how your mind's thinking, and there's a split there. And that's why with the Greek roots, schizo means split and phrene means mind. And like mentioned, Bleuler emphasized this term for mental confusion and fragmented thinking. So every time you think of schizophrenia, it's about the thinking and the thought processes, not about the personality and behavior. And here's a picture of what the diagnostic criteria would look like in the DSM-5. It gives us sections A through F. And in order to qualify and be able to be diagnosed for schizophrenia, there needs to be at least 2 symptoms present during a 1-month period or longer from criterion A. And unfortunately, there's not much to use in order to identify schizophrenia. We don't have enough we don't have a medical test to diagnose someone with it, because it is a rare mental illness, and it's very hard to be able to see if someone has schizophrenia. You have to really pay attention to the symptoms and the patterns and behaviors that they are showing. And basically, if you show delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms, you need at least 2 of those. And in the video that I will show, they do say that basically, as long as the top 3 that really are focused on are delusions, hallucinations, and disorganized speech, that are the main ones. That should be 2 or more. And there is impairment in 1 or more major areas of function, which includes the cognitive and functional impairment found in criterion B, and goes more into depth with that. And in criterion C, you must show signs of disturbance, and it needs to be persistent for a continuous period of at least 6 months, which basically means the active phase systems. And the active phase systems are basically the delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, negative symptoms. So within that time frame, 1 month has to be shown in that active phase. And we'll go more into depth later on with that. And then for criterion D, E, and F, it just basically talks to us about how, for example, on E, the disturbance is not attributable to the psychological effects of a substance or another medical condition. And the video will go a little bit more into depth with that as well. Let me go back. And it's not known as to how one can get schizophrenia. Like mentioned, it's very rare. There's not medical tests. Less than 1% of people are affected by schizophrenia, and it's not easy to just identify and say, hey, you have schizophrenia. Like, you really have to pay attention, and that's why it's important that they track down the months and really see within the 6 months the drastic changes or how severe the symptoms get. And someone with the diagnosis of schizophrenia is at a higher risk of dying from suicide, with a percentage of approximately 5%. There are several factors, it could be physical, genetic, psychological, or environmental. And for schizophrenia, it's very common. It's more common in men. And they get diagnosed earlier because they are introduced to it earlier. So they'll be able to start showing symptoms in their early teens, late 20s, and then, late teens, early 20s, and for women, it's in their later 20s, early 30s. And for environmental, the season that you're born can have an effect on you getting schizophrenia. So if you were born in later winter, early spring, and in some locations during summer, you could be at a higher risk. And it's also higher for those born in urban environments and for some minority ethnic groups, but you can't really say that because of a cultural group or a certain population, you have schizophrenia. Because there are people who, in the genetic and physiological portion, as I mentioned in there, that those who are diagnosed with schizophrenia, many don't have a mental health history, like a family history of psychosis. So many people who have schizophrenia, their family members don't have it or don't have any other mental illness that shows. And if one has a pregnancy and birth complication with hypoxia or greater paternal age, it can cause a higher risk of schizophrenia as well. So for the suicide risk, 5 to 6% of individuals do suffer from schizophrenia and can commit suicide. 20% attempt suicide. And there isn't an exact number of those who have had suicidal ideation. But many don't know that they are suffering from schizophrenia. So there's not many people getting the proper treatment for it. And suicidal behavior could be influenced by the hallucinations to harm oneself or others. And other risk factors that are included are depressive symptoms, as well as feeling a sense of hopelessness. And many people assume that if someone has schizophrenia, they're the ones harming others or being very violent. And it could happen. You can have violent behaviors. You can show some violent symptoms, but it's actually the other way around. Someone who has schizophrenia is more likely to be harmed and suffer in that sense because, like mentioned, there's not enough treatments out there. There's not enough to help, and many don't have the resources to be treated. So for warning signs, as I mentioned, hallucinations, illusions, disorganized thinking, then when you start seeing a lack of motivation, slow movement, change in sleep patterns, poor grooming and hygiene, changes in body language and emotions, less interest in social activities, and low sex drive, these are warning signs that you want to really pay attention to and see how common or how often they're happening. So we have positive, negative, and cognitive symptoms. So all the abnormalities that were mentioned earlier are all positive symptoms. In the video that I will show, go more into depth into how they affect somebody. And for negative symptoms, it's just more of like you lose interest, you're not showing emotions, um, no motivation, pretty much. And the cognitive symptoms, it's more of like they start getting affected. So it's harder for you to remember things or to learn and really comprehend and understand stuff. Um, but it's very hard to see if someone is having cognitive symptoms because we can forget a few things here and there, like a phone number or take out the trash or just something so tiny that's a small task. And many don't really know that that could be an issue. And that's why it's important, they say that it needs to be a month to 6 months of really being able to see and track um, these symptoms to have a true diagnosis. And there's also vocational and functional impairments. And for the phases, as mentioned, in all the active phases or in the active phase, these abnormalities, one of them has to be present for 1 month within the 6 months. And it's never ending. So, it'll be predominant, active, residual, and then it just keeps going. And then at times, the active phases will be greater than others, or there'd be times that the individual suffering from schizophrenia will be in the prodromal phase, or they start really struggling with concentrating because of the residual stage. So there's no specific order. It varies, and everybody has their own experiences with it and their struggles with it. They struggle with it differently. Not everyone's going to feel the same symptoms. It affects everybody differently. So the screening tools and assessments that they do use are positive and negative syndrome scale, the scale for the assessment of negative positive symptoms. There are two separate ones. So one's for the negative ones and for the positive symptoms. The brief psychiatric rating scale, the clinical global impression schizophrenia, and the Calgary Depression Scale for schizophrenia. So for medication, and antipsychotics are used. There's haloperidol, fluphenazine, and chlorpromazine. But if you don't respond well to the medication, electroconvulsive therapy is suggested. And for resources, it's highly recommended to get individual or group therapy, as well as social skills training. And there are hotlines and websites to help you, like Schizophrenia and Related Disorders Alliance, National Alliance on Mental Illness, Mental Health America, National Institute on Mental Health. And I am going to show you the video that I found. Let me make sure that you can hear it. Stop share screen. And I will play this for you right now.
Schizo means split, and phrenia in this case refers to the mind. Even though schizophrenia can be interpreted to mean splitting of the mind, it does not refer to a split personality, like some media sources might portray, but rather schizophrenia describes a scattered or fragmented pattern of thinking. Schizophrenia is actually a syndrome, meaning there are all sorts of symptoms that might be associated with it, and different patients might experience different symptoms. Although the symptoms can be broadly categorized into three major areas: positive symptoms, negative symptoms, and cognitive symptoms. Alright, taking a step back, most human symptoms from any illness are extreme versions of a normal physiologic process. For example, everyone has a heartbeat, right? And tachycardia is a fast heartbeat. In the same way, everyone has a normal body temperature, but during a fever, that temperature is higher. In schizophrenia, patients have positive symptoms, which aren't positive in the sense that they're helpful, but positive in the sense that there's some new feature that doesn't have any normal or physiologic counterpart. These are the psychotic symptoms, so delusions, hallucinations, disorganized speech, and disorganized or catatonic behavior, none of which occur physiologically. Delusions are false beliefs that the person might feel very strongly about, so much so that they won't change their mind, even if you give them evidence against it. There are all sorts of different delusions, like, for example, a delusion of control, where somebody thinks that some outside force or person or thing is controlling their actions. There could also be delusions of reference, where someone might think that insignificant remarks are directed at them, like a newscaster is speaking directly to them through the TV. Hallucinations are a second type of positive symptom, and can be any kind of sensation that's not actually there, including visual, but also including auditory sensations, like hearing voices or commands. A third type is disorganized speech, an example being something like a word salad, which seems like just a random jumbling of words or phrases, like pencil, dog, hat, coffee, blue. Disorganized behavior, on the other hand, could be like if they exhibit some bizarre or silly behavior that's out of context and doesn't seem to have much of a purpose, like, for example, wearing multiple layers of jackets on a hot summer day. Also, sometimes their behavior is described as catatonic, which has to do with their movements, posture, and responsiveness. So, like, they might be super resistant to moving or be in an unresponsive stupor. Negative symptoms are like when there's this reduction or removal of normal processes. And this is like a decrease in emotions that they can express, or a loss in interest in things that they once found interesting. One type of negative symptom is called flat affect, where they don't respond with an emotion or reaction that would seem appropriate. Like if they saw something very unexpected, like a small monkey playing in their living room, they might simply sit and watch idly as if nothing was happening. Another type is alogia, or poverty of speech, which is a lack of content in their speech. So like if somebody asks them, "Do you have any children?" They might respond with, "Yes," instead of, "Yeah, one boy and two girls." A third type of negative symptom is avolition, which is this decrease in motivation to complete certain goals, so someone might stay home for long periods of time without trying to reach out to friends or find work. Cognitive symptoms are like not being able to remember things, learn new things, or understand others easily. These symptoms are more subtle though, and are more difficult to notice and might only be detected if they have really specific tests performed. An example might be somebody not being able to keep track of several things at once, like a phone number and an address. People with schizophrenia seem to cycle through 3 phases, typically in order. During the prodromal phase, patients might become withdrawn and spend most of their time alone. And a lot of times this seems similar to other mental disorders like depression or anxiety disorders. During the active phase, patients experience more severe symptoms like delusions, hallucinations, disorganized speech, disorganized behavior, or catatonic behavior. Following an active phase, patients often enter into a residual phase, where they might exhibit cognitive symptoms like not being able to concentrate or becoming withdrawn again, as with the prodromal phase. For an official diagnosis of schizophrenia, patients need to be diagnosed with 2 of the following symptoms: delusions, hallucinations, disorganized speech, disorganized behavior, or catatonic behavior, or negative symptoms. And at least one of them has to be either delusions, hallucinations, or disorganized speech. So basically, they couldn't have just disorganized behavior and negative symptoms. Even though some patients have cognitive symptoms as well, they aren't specifically needed for a diagnosis. Also, though, for a diagnosis, signs of these disturbances must be ongoing for at least 6 months, meaning that they're likely in one phase or another for a period of 6 months. But there must be at least 1 month of active phase symptoms. And finally, those symptoms can't be attributable to another condition, like substance abuse. Now that we've diagnosed it, why does it even happen in the first place? What causes schizophrenia? Well, we don't really know, since it seems like the signs and symptoms of schizophrenia are pretty unique to humans, or at least they're hard to imagine or notice in animal models like mice or rats. One clue is that the majority of antipsychotic medication that improves schizophrenia symptoms block the dopamine receptor D2, which reduces dopamine levels in neurons. This suggests that maybe schizophrenia has something to do with increased levels of dopamine. These medications, though, are neither universally nor completely effective, and don't work for everyone with schizophrenia, which adds to the confusion and means there's probably more to it than just the D2 receptors. Interestingly, one of the most effective antipsychotic drugs, clozapine, is a weak D2 antagonist, suggesting that other neurotransmitter systems like norepinephrine, serotonin, and GABA are involved. Twin studies have shown support for a genetic basis as well, even though there haven't been any specific genes conclusively linked to schizophrenia yet. Also, environmental factors like earlier prenatal exposure to infection and certain autoimmune disorders like celiac disease have been linked with schizophrenia. Finally, another important set of clues involves the epidemiology. Schizophrenia seems to happen slightly more in men than in women, with onset in the mid-20s for men, but late 20s for women, and the clinical signs for schizophrenia are often less severe. Some studies suggest this difference might be due to estrogen regulation of dopamine systems. There doesn't, however, seem to be any difference among race. Now, treating schizophrenia can be really tricky, and antipsychotic medications are often used, but it's super important to combine the efforts of several clinicians and health professionals, including professionals in therapy or counseling, medicine, and psychopharmacology. Antipsychotics can be very effective at reducing symptoms, but they often come with a lot of additional considerations to keep in mind, like cost and the potential for unwanted side effects like tolerance, dependence, and withdrawal.
Okay, and that was the video. And now I want to be able to show you um this is a brief psychiatric rating scale, one of the assessments that I mentioned earlier in the presentation. And this is how it looks. Um, and then there's also this cool brochure that I was able to get from the National Institute of Mental Health. And it has all the information of schizophrenia and what we've talked about. I will put the link for this um, with the presentation. And that is pretty much it. And oh yes, I had one more. Is it this one? No, it's not. I will also attach the another assessment. Oh, here it is. Oh, hello. Oh my goodness. There we go. So this is how, for example, a positive and negative syndrome scale would look. And you put the information of the patient, personal notes, and then it starts going through the questionnaire. And I will also attach this. And okay, that is all I have on schizophrenia. And if there are any questions, I will answer them. And that's it. Thank you.